This is sometimes the most difficult part of your case. This is the treatment phase. This is where you're getting treatment for your injury. It can be frustrating. It can take a long time. Typically, this is one of the most prolonged phases as we're just waiting. We are waiting for your doctors to look at your injuries and help you get better. Sometimes it's frustrating because I know that you want to get better, and the doctors don't always have the answer right away. Sometimes the answer is, well, we have to wait and see. Let's just see how this treatment goes and see if it makes you better. And sometimes when you're in the middle of it, it's so frustrating because you just want to be better and you don't get all the answers that you need. Also, it can be frustrating on the legal side of it. We understand that while you're waiting for answers on your medical treatment, you also want answers about your case. You want to know, hey, are things moving forward as they need to be? What's going on with my case at this time? Now, the reality is, if you call in during this phase and ask for an update on the case, the answer will probably be, we're waiting for the treatment to see how things are going. But it doesn't mean that nothing is happening. So our goal during this phase is we want to get you better. We want to make sure you're getting the best treatment and that you're getting enough treatment to get you better, because we want to get you back on your feet. We want to get you, hopefully we can get you back to 100%, but if not, as good as you can be, as fast as it can happen. And so what we want to do is we want to make sure we're working with you to make sure you're getting good treatment. If you're having any issues with your medical provider, sometimes I know it can be a challenge where your doctor's recommending physical therapy, but you can't get an appointment for like 3 months out, or it's hard to get in to see your doctor, or you feel like the doctor is just not paying attention to you. You're just a number. They don't really care about getting you better. If you have any issues with your medical providers, let us know. We also can help you find good medical providers. Because of what we do, we know a lot of doctors. We know doctors who can help you with your particular needs. And also, we can make sure that there's money to pay for those doctors. So never feel like you can't get the help you need. So during this phase, it's important that you communicate with us. Let us know what's happening. We don't need an update on every single visit with the doctor, but we'd like to have an update if there's anything important. If anything you feel is important, please let us know. If you have a question about your treatment, please let us know. If you want to know an update about your case, know that we're not going to settle your case yet. It's not time. We want to make sure we have a clear picture of what your injuries are. And here's an example of why that's important. Now let's just imagine that you have a neck injury. Now, you might think at the beginning of the case, oh, it's a little painful. It's going to get better, though. And so we say, oh, let's just settle your case. The insurance company's offering a few $1,000s, and we go and settle your case for a few $1,000s. And then 6 months down the road, the pain doesn't get better. And now the doctor's telling you, you know what? You need to have neck surgery on this. You don't get a second chance on your case. We can't go back in time and say, well, let's undo the settlement because we didn't know that we needed neck surgery here. So that's why it's so important that we wait. We want to make sure we have a clear picture before we start talking about settlement with the insurance company, because if we settle too soon, there's a chance that we're not going to do it right. And it's more important to do it right. Sometimes it can be overwhelming with all of the medical appointments that you have to have. It really upends your life. Now, instead of living your life and doing what you want to do, your life sometimes revolves around these medical appointments. You got to rearrange your schedule, maybe take time off of work, find somebody to help drive the kids where they need to be so you can go to your medical appointments. You got to schedule them and work things out, and it can be frustrating. And sometimes you may feel like, is it doing any good? Why am I going to these appointments? Understand that it sometimes takes time. You're not always going to get better just by one visit to the doctor. Sometimes there's more that it takes, and it's so important that you go to your medical treatment because it will help you to get better. The doctors are there to help you. Also, in your case, even though you might be hurt even without going to the doctor, the insurance company and a jury, they need evidence. They need to have something that shows what the injury is. And that's why it's so important that there are doctors to document what the injuries are. And so if you're hurt, you need to be treated so you can get better, and also to make sure that the person who caused your injury can be held accountable. Now, if you're feeling better, well, of course, that's the time that you can stop your treatment and let us know that we're ready to move to the next phase of your case. We never want someone to go to the doctor just so they can get more money in their case. We want you going to the doctor so you can get better. Now, if a doctor or another specialist wants to do a procedure or a surgery, what should I do? This is a question when it might be important to reach out to us at this time because it's a big decision. Now, our number one priority is getting you better and getting you healthy. And sometimes it can be a big decision to know, well, should I do this or should I not? Now, what we can do as your lawyer, we can talk to you about your case and the legal ramifications of it. I don't want to give you advice on what is best for your health. That should be a conversation between you and your doctor to make sure you're making the choice that is best for you. Now, that's a big decision. Sometimes with any surgery or procedure, there's often risks involved, and you have to weigh the different risks. Is it worth getting me better? Am I willing to go through with these risks, and what are the side effects, and what are the potential complications? So those are all important questions to look at. We never want to push you into something that makes you feel uncomfortable. And remember, the number one goal, the question to ask yourself is when you're wondering, should you do this procedure, is ask yourself, is it going to help me get better? Because if it helps you get better, that should be your focus and that should be your goal. So the insurance company and the attorneys representing the defendants in our cases, they will do anything they can to try and minimize your injuries, make it look like you're not hurt or you're not really hurt that bad or that you did something wrong. That's just what they do. And so even if you are significantly hurt and they see that you have just sporadic treatment, you haven't gone to the doctor very much, they're going to use that to devalue your case. They will offer much less compensation, even if you're significantly injured, if we don't have consistent medical treatment. You have to treat your injury if you want to get better. And you want the insurance company to be able to pay you what you deserve. So it's so important that you have consistent treatment where the doctors are documenting this is what the injury is, this is what we're doing to treat you and get you better. Without that, it's going to be hard to get you what you really deserve in your case. Yes, we want to know anytime you go see somebody new. If your chiropractor or your doctor refers you to a specialist, let us know. If you get an MRI or other imaging, let us know. If there's anything new, any big changes, that's when we need to know. Do you need to let us know about every single appointment that you have? No, we don't need that. But let us know whenever there's a change or something important. Communication is key. I wish I knew the answer to how long your medical treatment would take. In reality, every injury is different. Every person is different. Sometimes we see injuries that we think are similar. With one person, it might take 2 months. With another person, it might take 2 years. And so there's often no way of knowing exactly how long your injury treatment will go. Your doctors will often give you guidelines, let you know what to expect. But we know that reality is often different than expectations. We know that sometimes a doctor might say, oh, this should take 6 to 8 weeks, and it takes a lot longer. And so the short answer is, it takes what it takes. Whatever it takes to get better, we want you to continue to work with your doctors to get better.